Hello, this is Dr. Clark. Welcome to our first mini lecture on Chapter 12, Dietary Supplements and Over-the-Counter Drugs. In terms of our agenda for these lectures, this particular set, we're first going to be talking about dietary supplements, how they're regulated, and the role of the FDA, and then we'll talk about some specific supplements. Then we'll move on to over-the-counter medications, or OTCs, and we'll discuss some specific OTCs of note. So starting with dietary supplements, it's important that we have this discussion about whether dietary supplements are food or drugs because of the way that can affect their regulation. So if you think back to our early definition of what a drug was, it was a substance other than food. And we had to exclude that by definition because drugs and food really are similar in some respects. Basically, they both contain chemicals that interact with our body's physiology. So the problem here is that dietary supplements are classified legally as foods, but thought of as drugs by consumers. For example, if you're familiar with the use of St. John's wort to improve mood, you would think of that basically as if you were taking a drug, something that would help your body to function better or differently. But legally, it's classified as a food product, and that has some very interesting effects on the regulatory process. So if you look at how maybe say that John's wort is packaged and labeled, you'll see that it is not labeled in the way that you'd expect from your experience with over-the-counter medications. And actually this label is much more just visually reminiscent of our food labels where we see nutrition information. So basically, we see what's contained in the bottle, the amount of calories, and then the daily recommended serving size and the number of servings per container. So lots of things that are pulled from the equivalent label that we see on food products. Basically, the regulation of supplements is governed by the Food, Drug, and Cosmetic Act. And its definition here, the functional definition of a drug, is a product intended for use in the diagnosis, cure, mitigation, treatment, or prevention of a disease. Now, if something is classified as a drug, the Food, Drug, and Cosmetic Act requires that the drug must be shown to be safe when it's used as directed and effective for its intended use. So we've got some requirements in place that some barriers that drugs must meet before they can be released to the market. Different classifications for food products. Foods must be safe and pure or unadulterated. So they're not required to show that they provide any of the benefits that they may claim on the outside of the package. So if you think about how that affects our bottle of St. John's wort there, if it's considered a food, then it doesn't have that requirement of effectiveness that it would if it was considered a drug. Some other regulation for dietary supplements, the Dietary Supplement Health and Education Act, which was passed in 1994, was passed primarily in part due to pressure on Congress from the supplement industry. There's a lot of money there, and anytime we see a lot of money, tend to see a lot of lobbying power. And there was an attempt at the time that the FDA would start regulating the supplement industry, and it wasn't something that the industry was interested in. So instead, they passed this alternative piece of legislation. So the Dietary Supplement Health and Education Act did make some important changes. It did redefine which substances could be considered dietary supplements, and it redefined what presumed safety meant. And it did allow some vague health claims like supports mood balance without proof. So they're able to put that on the bottle of St. John's wort, even though they don't have or may not have clinical evidence to support the kinds of assumptions that they're printing on the labels. If they go too far, the FDA will get involved and ask them to pull the claims back, but they are allowed to make some vague claims related to health, even though there may not be proof to support them. So that change in the definition of supplements actually expanded it. So we're increasing the number of substances that are included under this broader definition. It includes vitamins and minerals, herb concentrates, extracts, and whole herbs, and then also amino acids. So that basically it exempts these categories from more stringent regulation by the FDA. Now, the definition of safety here is important because people do tend to consume these products assuming that they're safe. And the Act does require that the products released are safe. But in terms of, if we're going to define safe, that means we also have to define what unsafe means. Now, the FDA can declare a dietary supplement to be unsafe only if it presents a significant or unreasonable risk of illness or injury. So it's a pretty high bar for the FDA to reach, and it has to be the FDA that proves that the supplement is not safe, as opposed to the manufacturer proving that the supplement is safe. So a much more reactive position than we'd like to be in. Now, in terms of ingredients that were already on the market at the time of the Act, they were considered safe enough to be sold. So it's not that the products have been tested or that they've been researched. Basically, it's just that they were in common use at the time, so they're going to be grandfathered in and allowed to continue being sold, unless the FDA can demonstrate a risk. If you think about some of the news stories related to ephedra and its impact on cardiac arrest, if the FDA can demonstrate that kind of risk, then the product is no longer considered safe enough to be sold. But again, think about that position that the FDA is put in, where they have to prove that the product is unsafe, as opposed to the manufacturer proving that it's safe, which is the relationship that we use when we talk about prescription drugs. We have seen some recent rules emphasizing safety, primarily, again, driven by the industry trying to avoid being more carefully regulated by the FDA. We've got the rules related to manufacturing practices, and then an adverse event reporting system that the industry has created. But again, these rules are still far more lenient than those for even over-the-counter drugs, much less prescription drugs. So that label that we looked at on our bottle of St. John's wort contains some basic information, but it didn't claim to be treatment for a specific disorder. So it wouldn't say something like, say, St. John's wort treats depression. They talked about positive mood balance, that vague claim. They can't actually claim to be a treatment for a disorder, but what they can say is that it has beneficial effects for a particular bodily structure or function, or on well-being. There doesn't have to be any evidence for these vague claims, but the only thing they have to provide evidence for is that the claims aren't false or misleading. So they get a great deal of leeway in how their products are packaged and labeled. Now, the label does have to carry a disclaimer that you're probably familiar with, that the statement has not been evaluated by the FDA, and that the product or supplement isn't intended to diagnose, treat, cure, or prevent any disease. If you've seen that, basically that means that what you are consuming is very lightly regulated by the FDA. If you're sensing a tone that I think you should be concerned about these products, that is definitely something that I recommend, particularly to an undergraduate audience. Tend to be people who are very concerned with health and fitness, and perhaps more likely to take some of these supplements than other kinds of populations. So please definitely be aware of what you are taking, and the fact that the FDA plays a very minor role in how those products are regulated and tested. So this new piece of legislation, has it increased safety, or has it been a threat to consumers? Basically, after the legislation was passed, we did see many more supplements arrive on the market, so consumers have more options. Now, in terms of cons, we do see very little research available about the safety and effectiveness of these supplements. And basically, supplements now are able to remain on the market until the FDA presents that clear evidence of risk, so putting that burden on the FDA to prove that the product is unsafe. And a little bit more about ephedra. It was first available as a stimulant for weight loss. And in 1994, we saw the first evidence of safety concerns linked to cardiac arrest, but it took 10 years for the FDA to get enough evidence together to get the ephedra off the market. When if we'd done some basic testing before the product was released, we would have been able to we may have been able to save the lives that were affected by the consumption of that substance. So it's really a case of buyer beware, I suppose. You really need to be aware of what you're purchasing. Basically, the law requires a couple of things for supplements. It requires that there are no specific health claims made on the label, and that it contains what the label says it contains. And even in that case, it may not be true, because we do see supplements that are pulled off the market regularly because they contain ephedra, which is now a banned substance, which can't be placed on the label but is still in the product. So definitely a potential health risk whenever you're consuming supplements of this kind. So one more recent piece of legislation, the Dietary Supplement Act from 2010. This was sponsored by Senator McCain, and it made some basic innovations that would have protected human populations. It required manufacturers to register. So think about that. Supplement manufacturers not currently registered with the FDA, so no requirements for the manufacturing facilities to be inspected or maintain standards. That manufacturers would have to provide a complete list of their ingredients, and the FDA could recall any ingredient they found to be unsafe. Basically, the industry mounted an aggressive campaign against the bill, and it was withdrawn. If you're looking for some more information on what the FDA is currently able to do or not do, that website there will lead you to a link that explains their current role. But that legislation that was proposed by Senator McCain in 2010 not passed, so we still are governed by the previous set of legislation. So we'll wrap up here for Lecture 1, and we'll be back to talk about dietary supplements specifically that are psychoactive.